Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Myomectomy. Hysteroscopic myomectomy. In hysteroscopic myomectomy, type 0 and type 1, hysteroscopic myomectomy is seen in type 0 and is done in type 0 and type 1 submucosal fibroids. In type 2, submucosal fibroids are intramural or subserous fibroids. In this case, we do laparoscopic or abdominal myomectomy is done. If number of
Submucosal type 2 submucosal, intramural and subserous fibroid, laparoscopic or abdominal myomectomy is done. If number of
fibroids are more than 4, then the size of fibroid is more than 10 centimeters. The size of uterus is more than 17 weeks. Then laparoscopic myomectomy cannot be done.
that is laparoscopic myomectomy cannot be done if there are more than or equal to 4 fibroids, or if the size of the fibroid is more than 10 centimeters, or if the size of uterus, the size of fibroid is more than 10 centimeters, and if the size of uterus is more than 17 weeks, then laparoscopic myomectomy cannot be done.
That is three situations. If the number of fibroids is more than 4, or if the size of the fibroid is more than 10 centimeters, or if the size of the uterus is more than 17 weeks. In such situations, laparoscopic myomectomy cannot be done. Pre
thank you and thank you for watching.